Hello, my name is Megan Durhammer, and I am a student nurse at Cedar Crest College in the Nursing Research 1 course. My study critique is on the different lying positions and their effects on tissue blood flow and skin temperature in older adult patients. The research question for this study is, do different lying positions have an effect on the risk for pressure ulcers and skin breakdown in older adults? The research problem is that older adults are at a risk for pressure ulcers the longer that they lay in a position, and these pressure ulcers and skin breakdown can prevent healing for the patients. The purpose of this study is to compare the effects of lying in the 6 different positions. The study design, it was a quantitative study, and it was a descriptive comparative design. The dependent variable was the participating patients, and the independent variable were the different positions that the patients had to lie in, as well as skin temperature. Both of the variables were operationally defined. The sample of the study was a convenience sample. The participants were patients on the neurological, geriatric, and medical emergency units at a university hospital in Sweden. The participants did need to get permission from their physicians before they participated to make sure that they were not at any risk for the current skin breakdown. The sample size was 20 participants. This included 10 men and 10 women. The inclusion criteria is age. The adults had to be 65 years or older to participate, and mobility, meaning that they had to be able to move freely between the different positions, the 6 different positions to be exact, and they needed to do that pain-free. The exclusion criteria is a fever or skin damage. The skin damage could be either current skin breakdown or pressure ulcers, or a history of pressure ulcers or skin breakdown. For the data collection, a 2-channel photoplethysmography instrument was used. This instrument measured skin temperature in the different positions of the patient. And they also did a pressure ulcer score risk to determine if the patients were already at a risk for pressure ulcers or not. The participants were instructed to lie in 6 different positions. They included 2 supine positions, 2 semi-Fowler positions, and 2 lateral positions. The 2 supine positions were at a flat supine position and a 30-degree angle supine position. The semi-Fowler positions included one of the positions to have the head of the bed at a 30-degree angle, and the other to have the head of the bed at 30 degrees and the feet of the bed at 30 degrees. The lateral positions were at a 30-degree angle and at a 90-degree angle. The limitations of this study were potential motion artifact. Even though the participants were instructed to be as still as possible and to be as quiet as possible, the researchers believe that the participants may in fact have had some slight movements. Also, false skin temperature. This could be caused by the room being either too warm or too cold for the participants, or even the blankets or the sheets of the bed increasing the skin temperature. Another limitation of this study would be the short time period. The time period that the participants laid in each position was 5 minutes, and the longer that you're in a position, the more likely you are to develop the pressure ulcers. So they're unsure if the time period was too short to determine any trend. The implications of this study, an increase for pressure ulcers would be the length of time that a participant is in a specific position, the moisture increase from being in these positions, which could also increase the temperature of the skin, and a decrease for pressure ulcers would be skin thickness. So typically over thicker areas of the skin, there is not as much of a risk for the pressure ulcers, but over thinner skin, which usually occur over bony prominences, such as the elbow or the heel of the feet or even the patient's backside, there is an increased risk for pressure ulcers. How does this affect the nursing process? as a nurse, we want our patients to get better, and we are here to help and heal the patients. However, if the patients are developing pressure ulcers and skin breakdown, this is preventing them from healing. And so this might make us have to implicate some, different techniques to get the patient up and out of bed, or if they are unable to get up and out of bed, to even reposition them every few hours, or even to use some sort of cream to create a barrier so the patient isn't developing these ulcers. The results of this study is that there is an increased blood flow over the superficial skin, which again is over those thinner skin areas and bony prominences, and an increased blood flow in the 30-degree lateral position. There was a decreased blood flow in the supine positions. However, despite these results, there was no specific trend. The conclusions of this study is that lying positions do in fact influence the skin breakdown. The researchers did indicate that they would rather do further studies to be specific as to how the lying positions influence skin breakdown and how the time in these positions influence skin breakdown, as well as the heat accumulation from being in these positions. These are my references. I used the textbook as well as my article, which was different lying positions and the effects on tissue blood flow and skin temperature in the older adult patients. Thank you very much.